If you went to a hospital, you would have the same things at your disposal in our clinics. Difference primarily is that you come to our clinic, you register directly with us. If you've been in our system before, that registration is already there, and parking's right outside the door, so the experience is much more quick than going downtown, going to the hospital, finding parking, going to registration, and going to the department. So we've tried to replicate that same facility in an outpatient basis.
Imaging at large clinics and hospitals often requires difficulty with parking, traveling through a complex hospital, often by very sick patients.
Many of them know that what that usually means is driving to the hospital, finding parking. First, it means can they even get an appointment in the next few days or in the next few weeks. If they get that appointment, then it requires driving to the hospital, finding parking, walking into registration, waiting to register, finding their way through the hospital to try to get that test done, waiting even longer, waiting for emergencies, which then will take their place. And then by the time they leave, it's literally been half a day that they've spent there getting that one test. And then it usually takes several days or even sometimes weeks for that report to get to their doctor. And what we've tried to do is really take that whole experience and completely change it.
With our whole electronic architecture, from our scheduling to the interface with the modalities themselves, and the modalities are MRIs and CAT scanners, ultrasounds, etc. It really helps us streamline that process so that if you are getting an imaging examination, your physician office can call us, fax us a report. They can even deliver that to us electronically. You can come in, we already have that information, the registration process is very quick. You park right outside our door. Because we're able to manage this process and the schedule electronically, we're able to, I think, with the exception of emergency patients that sometimes throw our schedule off, we're able to keep a fairly predictable schedule time so that if you come in for a 2 o'clock CT scan, you're not going to be sitting out in the waiting room until 4 o'clock.
We try to perform services within as little as a 15-minute wait time for patients, and most studies are read within 24 hours for a quick turnaround report to your physician.
We're able to see patients and do their CAT scan or their MRI or their X-ray procedure the same day. We will have a report back to their doctor within 24 hours, usually the same day.
There are many, many imaging facilities in Louisville and the surrounding area. So the question is, what imaging facility will you end up going to?
One thing that I don't think patients understand is their decision to decide where they're going to have their imaging is their decision. There is no requirement to go to any one specific imaging location. Patients can make that choice on their own.
I think that too many times patients feel that if Dr. Smith says you need to go downtown to hospital Y, that's where they have to go. And that's really not the case at all.
So when a patient sees their doctor and their doctor determines that they need a CAT scan or an MRI or an imaging procedure, what patients need to understand is that it's their choice and their decision as to where they get that procedure done.
Now, many physicians have their preferences based on years of relationship with a particular radiologist or a particular hospital or a particular imaging center. And that's part of the equation.
That nobody can tell that patient where they can get that done. And so most patients will choose to get it done at a very high quality place where they can get in either the same day or the next day, not have to wait, and they know that highly trained subspecialized doctors who are some of the best in the region will be interpreting that study and getting a report back to their doctor within 24 hours.
But a lot of it is convenience to the patient. Does the patient want to go all the way across town to go to that imaging facility, or do they want to go to one that's in their neighborhood that they feel like they can trust? The law is very specific, which says it is the patient's choice. It's not the physician's choice. It is not the receptionist's choice. It's the patient's choice. So if the patient says, I've really heard a lot of good things about some facility, whether it's ours or not, they're in their full right to choose that facility.
Imaging at large clinics and hospitals often requires difficulty with parking.
Walking into registration, waiting to register, finding their way through the hospital to try to get that test done, waiting even longer,
Traveling through a complex hospital, often by very sick patients.
waiting for emergencies, which then will take their place. And then by the time they leave, it's literally been half a day that they've spent there getting that one test.
Whereas at DXP, we've streamlined the process. Easy parking, easy entry, very little waiting time.
Fast, friendly service, highly specialized technologists, all of whom are certified.
A huge advantage of our outpatient radiology department, which again really replicates the full services of a radiology department, is you're going to have a much more predictable schedule. And that means I think that's huge, as busy as we all are these days, not to have to dedicate a whole day or a half day just to get a CAT scan or an MRI.
We're able to see patients and do their CAT scan or their MRI or their X-ray procedure the same day.
DXP basically is one-stop shopping. All of the latest advancements in imaging technology are all available at DXP.
They'll get their procedure and their doctor will get a report back the same day or within 24 hours. And I think that takes an enormous amount of the stress of going through getting these tests out of the process. So in addition to the high quality, we've also made it extremely convenient and patient-friendly, and I think patients really appreciate that.
Our group has really dedicated a lot of resources into developing the kind of radiology group or staff that we feel like has the highest chance of making that maybe critical diagnosis for you. And we've done that by seeking out radiologists that are from excellent training programs across the country.
All of our radiologists are board-certified radiologists, which means they're certified by the American Board of Radiology, and that's very important because not all doctors are board-certified. To become a radiologist, it requires medical school, 5 years of internship and residency, which is specialized in radiology, and for many of us, an additional 6th year of what's called fellowship, which is subspecialization.
So they have special training in addition to the 4-year diagnostic radiology residency training program, additional training in their field of expertise. So at DXP, it's very important to us that every patient who comes has their study read by the person who is most qualified to read that study.
In addition to being specialists in radiology, every member of the group, every physician has an additional subspecialty in a different area of the body. So we have a specialist in the brain and in the spine, specialists in the lungs, specialists in the abdomen, specialists on the arteries and the circulation. And so that adds a whole other level of expertise to our group.
Nothing beats experience, and when you have radiology technologists that have been doing this for years, their chances of doing this on the first stick and increasing your comfort level is much higher than a person with less experience.
Your study is almost always read by the radiologist that has done a subspecialty fellowship just in that type of imaging. So it's very important for patient care to have the best people reading the best studies, and that's what we do here at DXP.
Patients will come to DXP Imaging because generally for medical imaging, to take pictures of a problem inside the body.
DXP, or Diagnostic X-ray Physicians, offers all of the major modalities for imaging. If you start with the simplest type of imaging, an X-ray, which involves a patient standing in front of an X-ray beam with a film behind them, that allows us to image bones, etc. Nowadays, the film has been replaced with digital imaging techniques, just like the modern cameras. So we can do that all without film now, and actually less radiation. Ultrasound, as the name implies, uses ultrasound waves to image inside the body, and is very useful for certain organs like the liver, the kidneys, the gallbladder, and also for obstetrical gynecologic imaging. As you move up in complexity, you move to CAT scan, which we also offer. CAT scan also involves X-rays, uses it in a slightly different way that allows us to basically divide your body into slices like a loaf of bread, and we can peel away the slices one at a time to look at each organ through the body, and that gives us a nice three-dimensional image in our head as to where things, where abnormalities or normal structures are lying. MRI is also available. MRI does not use X-ray, actually uses magnetic waves to image the body, and is very good for soft tissue locations in the body, muscles, organs, etc., brain. There's also functional imaging, which tells us what the organs are doing, and that's what PET does. I give you a special tracer, and I see how it's processed by certain organs. Cancers process things differently than normal tissue, so that helps us to determine what is more, what we call metabolically active, and what is more likely to be a cancer. Interventional radiology is a subspecialty of radiology. Interventional radiologists use all of these imaging techniques, not just to diagnose, but also to treat different disorders. So that's what differentiates an interventional radiologist from a diagnostic radiologist.
We developed our businesses to really replicate a radiology department in a hospital. So we have the full gamut of services. We have MRI, we have CT scanning, ultrasound, all the things that you would, if you went to a hospital, you would have the same things at your disposal in our clinic.
DXP basically is one-stop shopping. All of the latest advancements in imaging technology are all available at DXP.
Our brand new CAT scanner, which is a very high-speed CAT scanner, is now also capable of doing 3D images, which is very important, particularly when you're imaging or looking at the arteries and the circulation in the body. That this allows us now to make diagnoses about blockages and the circulation in the body that used to require a procedure. So now we're able to make these diagnoses literally within a few minutes and have a three-dimensional image that will rotate and show us where all the blockages are in the body, which will allow us to figure out how to treat those blockages.
So all of the imaging options are available at DXP. In addition, DXP has 4 interventional radiologists, as well as 2 interventional musculoskeletal and spine specialists, who, in addition to using radiology techniques, use those techniques not just to diagnose, but also to treat different illnesses within the body.
Patients will come to DXP Imaging because generally for medical imaging, to take pictures of a problem inside the body, a CAT scan, MRI, X-ray, ultrasound, mammography. Many patients are also sent to DXP Imaging because we are the region's leading experts in the diagnosis and the treatment of PAD. And generally that's diagnosed first with a test called an ultrasound or a Doppler test. So many times your doctor will send you to us to get an ultrasound or a Doppler test to determine whether or not there are any blockages in the arteries.
We have one of the most advanced and well-trained vascular components. So we do a lot of work in the body opening arteries that are blocked to help people whose legs hurt when they walk to walk again, to help kidneys and other organs that are not getting enough blood get enough blood to function properly.
If a patient or a family member has the symptoms of PAD, we have peripheral artery disease specialists right here at DXP Imaging. And the majority of our patients actually come to the window and schedule an appointment. And generally an appointment can be scheduled within a week. Patients with PAD generally will undergo a procedure called an arteriogram or a catheterization. And most patients are familiar with this concept because they've heard of a catheterization of the heart. Well, we do catheterizations of the legs. It's pretty much a very similar thing. It's an outpatient procedure where a very small tube is threaded into the artery at the top of the leg. And this is done under just mild sedation, not anesthesia. That catheter is then threaded to the artery that's blocked using a big X-ray machine to show us where we're going. And then there are several ways that we can fix that blockage through that little tiny hole, which is about 1/4 of an inch in diameter. The first is called an angioplasty, which is a balloon that goes through the blockage and pushes it aside and allows the blood to flow down the artery to the leg. The second is called a stent, and the stent is a metal tube that forces open the wall of the artery and allows the blood to go down the leg again. The third is something called an atherectomy, and most people refer to it almost as a roto-rooter type device. And there are several different types of devices. We're actually the first people in the region who have used these devices when they first come out, and we're actually a test site for the latest devices that open up these arteries using that technique. And generally that is placing a small device through the blockage and either removing the blockage and taking it out of the body or boring a hole through the blockage. Again, all of this is designed to open up the artery, get the circulation to the legs, and to do it through a very tiny hole. When we're done, the patients get a Band-Aid, and they generally go home within 2 to 4 hours, and the next day they can resume normal activity.
Imaging has really changed drastically over the last 15 years. And if you look at where we were, say maybe 20 years ago, if you went to your doctor's office, you could get a radiograph, an X-ray. Ultrasound was just in its infancy. CAT scans were just beginning. MRI was unheard of at that time. So much of your visit really relied on the physical examination and what you could tell your physician. And as imaging has increased and its capabilities have increased and the costs have come down, what that has allowed us to do is to look in very fine detail at all of the organs in your body and the things that can go wrong, and help to make that determination and diagnosis much earlier than could have been done 2 decades ago, or even 1 decade ago. It's really changed that much. Medical imaging is important because it's a way to see inside the body and make diagnoses in a very quick and easy and painless way. And now the technology has developed to such a point that with the imaging equipment we have at DXP, advanced CAT scans, the latest MRI machines, ultrasound machines, we're able to diagnose conditions and problems that we weren't able to do even a few years ago. And that makes a big difference because you're able to find diseases earlier, you're able to find problems earlier, and then they're able to be treated earlier. In addition, there are things that we can see now that used to require a procedure or a surgery to find, whereas now we can see it with a procedure that may last 10 or 15 minutes.
The most important way imaging is used in treatment of disease basically has to do with my specialty, interventional radiology. And that's where we use imaging techniques such as ultrasound, CAT scan, fluoroscopy, which is live X-ray, to help us guide needles, catheters, devices within the body. It allows us to do this using very small incisions, which usually require no stitches, no sutures, very short recovery time, outpatient procedure, go home the same day. We use imaging quite frequently to guide procedures that, again,
maybe a few years ago could have only been done with open surgery.
So you can imagine if you were trying to find a tumor within the liver, if you were doing it in the operating room, of course you would open the patient, you would put your hands on the liver, you would find the lesion. Sometimes you would use intraoperative ultrasound and do it that way. But if I wanted to biopsy that same lesion, for example, it'd be very easy for me to take the patient to CAT scan, localize it under CAT scan, take a very specific needle without an incision and go directly right through the skin, the muscle, into the liver, into the lesion, take my biopsy with no incision. And of course the patient is sedated and very comfortable. The recoup time is markedly different. So it gives you an idea about how we use imaging to steer things within the body.
We're able to use that medical imaging to actually guide us as we go inside the body through a very tiny hole and fix whatever problem it is that we need to fix. So medical imaging now, CAT scans, ultrasounds, X-ray, MRI, can actually guide us as we go inside the body and fix problems in a very minimally invasive way.
Those kind of imaging guided systems allow us to come within millimeters of something, where we can so precisely biopsy something or sample something or even take things out now could have never been done before.